Hey guys, welcome back to the second part of our class. Hopefully you guys already watched the first part. If you didn't, I definitely suggest um, turning this off and watching that other video because that's going to give you the good foundation for what to expect once labor starts and kind of what labor and delivery is going to look like. And then you can come back to this video and we'll talk about labor support in more detail. So, again, it's the same instructor from before. I'm Sydney Combs, and we are going to get started with this. So, just a little heads up, this class is a little bit longer than the first one, but it's going to give you kind of the meat and potatoes of labor support and all those tools and tricks that are going to get you through labor. And I know we talked a little bit before about what labor looks like and the stages of labor. So now we're going to talk about how to manage each of those stages of labor, especially for mamas that haven't done this before. It can be daunting, and that fear of the unknown just always kind of hangs over your head no matter what. But I'm hoping that this class will give you some more tools in your tool belt to really feel like you know what's coming and you know how to manage it. So let's get started. These are the specialties that you are going to come in contact with at the hospital. So an OBGYN is an obstetrician and gynecologist. I'm sure many, if not all of you, have already seen an OBGYN already. So these are doctors that are specifically trained in maternal and infant health. A pediatrician is a children's doctor, so you might see a pediatrician before you deliver, but you definitely will after baby's born. A midwife is a nurse that is specifically trained in childbirth, so some of you may already be seeing a midwife. And it's just a different specialty. They're highly, highly trained nurses and fantastic, especially if you want you want to deliver with somebody that you have seen throughout your pregnancy. Midwifery is a good way to go. And an anesthesiologist or CRNA, these are doctors or nurses that are specifically trained to provide anesthesia. So if you get an epidural during labor, or if you have a spinal or any kind of anesthesia during a C-section, you will see an anesthesiologist or a certified registered nurse anesthetist. Your labor and delivery nurse you will be very familiar with during labor. This is the nurse that's going to be by your side from start to finish. And mother and baby unit nurses, these are nurses trained in postpartum care. So you're going to see them after you deliver until you leave the hospital and go home. I know this is one of the biggest questions that moms have going into labor and delivery is how am I going to manage my pain? So these are a few different ways for pain management options if you're not trying to go the natural route, or if you feel like you're going to need some extra support like this. The rest of the presentation, we are going to talk about some other things that can help you manage that pain during labor. But these are the medication-specific pain management options. So epidurals, I know all of you have heard about epidurals, and probably a good bit of you are planning on getting them. This is an anesthesia that is given in the epidural space in your back, and this will decrease sensation, typically from the belly down. A paracervical block and pudendal block, they aren't used as frequently, but they are options. A paracervical block is also known as a cervical block, and it will just block the nerves in the cervix, which is in the vagina. And a pudendal block is given in the pudendal nerve, which is in the pelvis, and that will numb mom's bottom and legs. And IV pain medication are used as a pain management option for a couple of different reasons. Sometimes moms don't want to get an epidural, or you're trying really hard to wait as long as you can to get an epidural. So this is a good option. These are just pain medications they can give you through your IV. So a little bit about epidurals. Um, you're not going to get one as soon as you get to the hospital unless you get to the hospital and you're already in active labor. And this is typically, there are outliers. If you've already had a C-section before, you probably get an epidural sooner. There's always the exception, but this is in general. So for the most part, your team, your doctor is not going to want you to get an epidural until you're about 4 to 6 centimeters dilated to get you into a good contraction pattern. There have been studies that have shown that epidurals can slow the labor process down. So we want you to get into that good contraction pattern, make sure those contractions are nice and strong, they're changing your cervix before we introduce an epidural. It used to be that they would say you couldn't get an epidural after 8 centimeters. The times have really changed. So with an epidural, it's not too late to get one unless you can't sit still or the baby is crowning. So if your baby's crowning, you just got to push. It's just time. And if you can't, you have to be able to sit still because it's a needle that's going into a space right around your spine. So those two things are very important. But don't stress about that. Your nurse will be able to help you kind of judge both of those things. IV pain medications are a great option to help you get through that earlier phase of labor, especially if for some reason you are admitted a little bit earlier or you're induced. Those IV pain medications can just kind of help you get to that epidural time. And one of the other big reasons why we don't want you to get an epidural until you're a little bit further along is because your pain threshold changes. So your pain level when you're 2 centimeters is going to look very different than when you're 8 or 9 centimeters. And those contractions will get stronger. Once your water breaks, they get stronger. So when you get your epidural, you get your maximum relief immediately after the epidural is placed. So that would mean that if you get your epidural when you're 2 or 3 centimeters and your pain, maybe you're feeling like it's a 10, but then by the time you really get it closer to 8 or 9 centimeters and those contractions have gotten stronger and stronger and stronger, you might start feeling like your epidural has worn off or like it's not working. But that's typically not the case. It's usually just that your pain threshold has changed. So if you wait until you're closer to active labor, which we know is 5 or 6 centimeters, you're going to get that maximum relief, and that really should carry you all the way through delivery. So there's a couple of different reasons. We're not trying to be cruel and force you to wait until active labor. It really does serve your best interest to wait a little bit. So another big question is what you should bring to labor and delivery. So there's several things that you should be sure that you bring, and then there's a couple of things that you shouldn't really worry about. So first, let's talk about what you should bring, or at least consider bringing. So you can bring a robe or a gown or comfy clothes or slippers, but typically I recommend these for postpartum, so after you've delivered, because I'm not gonna lie to you, labor and delivery is messy. So unless those are clothes or slippers or socks that you really don't mind getting messed up, I definitely recommend just saving your cute clothes for postpartum. You definitely want to bring personal items such as chapstick, toothbrush, toothpaste, hair ties, lotion, anything you need that's going to keep you comfortable. Sometimes the hospital has things like this, but just bank on them not having them and bring them with you. Nursing bras and pads. Some women feel more comfortable wearing a bra during labor and delivery. I don't recommend that. I recommend just being completely bare under your gown. because there again, it gets messy. And then once baby's born, they're actually going to put baby up on your chest. And if you've got a bra there, it just doesn't work really well. So there again, just save the bras and pads for postpartum. Socks, especially if you get cold feet, more than welcome to bring socks. Most of the time, the hospital have those little grippy socks for you, so that we don't want you to fall down while you're in labor. So most of the time, they'll offer those, but you can bring your own socks if you want. Any reading materials, things to distract you would be great. And extra pillows. Um, Hospitals have pillows, but for some reason they always seem to disappear. So if you're one of those people that likes to be propped up in bed like a queen and you want like 6 pillows, that's how I am, then I do recommend maybe bringing a couple extra, especially if you think dad's going to be sleeping. I would definitely bring 1 or 2 for him as well. So just a few more things you might want to bring. Definitely bring your camera, your phone. Please bring phone chargers and hard candy or gum. You can bring, typically in labor, they won't let you eat anything. There again, that's typically, but most of the time they'll let you have candy or gum. Just make sure you check with your nurse before you do. And anything that you think you might need for labor support or encouragement, and we'll talk a bit about this more in depth later so you can make some decisions, but a tennis ball, we'll talk about that. And any soothing music, family pictures, essential oils if you're an essential oil kind of girl. Lavender oil is great for relaxation. Peppermint or a citrus oil like lemon or orange is good for nausea. And those actually aren't super expensive. You can get them at CVS or Walmart if you think that's something that would help you. If you don't typically use essential oils, then I wouldn't specifically go buy them for labor. Okay, so the environment is something that's very important when you're talking about labor and delivery. Sometimes people get stressed out by being in the hospital setting. As you can kind of see in that picture, there's a lot going on. You've always got monitors hooked up to your belly, watching baby, watching the contractions. You've got IV fluids going, and it can just be kind of stressful. And most of us know from going to hospitals and doctors' offices, they're just not very cozy. So, these are some things that you can bring or just keep in mind to try to make it a little bit more comfortable. So, um, the hospital rooms typically have lights all over the place, so you can kind of play around with them and figure out what works best for you to keep the lights down low. Any kind of music that encourages you or soothes you is very welcome. You can use, iPad, iPod, your laptop, your phone, anything like that. I've actually had patients before that have made labor playlists and delivery playlists. So they play a certain one that kind of encourages them and pushes them through each contraction. And then, like, right before baby's going to be born, they have like a certain song they want baby to be born to. So they'll switch it over. So you can kind of play around with it and do whatever makes you happy. I do recommend minimal visitors. I'll put that in here. I mean, I don't think any of you mamas are going to have a whole lot of visitors at the hospital. Unfortunately, it's just kind of that time that we're in. But if you do have the option, or if you're delivering kind of after all of this stuff starts to lift, especially in the labor room, I do just recommend keeping it to a minimum. It's hard work bringing a baby into the world, and the more people, just the more chaos. So try to keep it simple. And minimal cell phone use. It's tough to be trying to bring a baby into the world and get through every contraction, and your husband's just constantly over there talking on the phone. So nothing against you dads, but just try to keep the cell phone use to a minimum. There again, pillows, make sure you bring some. Any other comfort items like blankets, oils, family pictures, we already kind of touched on that. And the hospital usually will provide ice chips and things like juice or crackers. There again, during labor, mom probably won't be allowed to have anything except ice chips and maybe some water. But for dad, especially if you think you're going to be at the hospital for a while, I definitely recommend some bringing some snacks. Just try to be mindful that mom's not eating anything and she's probably hungry, so don't like rub it in her face that you get to eat a Jimmy John sandwich, but I do recommend bringing some food to keep you going. So, this slide is really for dads or for the support person. Um, it can feel very isolating and lonely during labor because really mom's doing most of the work. And I just want you to keep in mind that you really play a very important role during labor and delivery. So just some things to ask yourself. What would I want if I were in her place? Is she finding comfort in the support I am providing? And just keep in mind the difference between pain and suffering. So I try to put this in here because it's very, very hard for dads to watch the person that you love most in the world going through that kind of pain. It can be very hard. But just remember that this pain has a purpose. It's not just pointless suffering. And she's not suffering. It's hard and it is painful, but every contraction is going to bring both of you closer to your baby. So just try to keep that in mind. She needs the support, but don't think that she's suffering. There is an end in sight. So there again, keep in mind labor is hard work. And you guys want to discuss plans for conquering labor together in advance. So you can talk about different positions that might be comfortable for her. Talk about massage, talking, whispering touch. We'll touch on all of that stuff in a minute. And also, just this is a big one. Don't take it too personally if she doesn't like something that you're doing. Most women have not been in consistent pain like this until they go through labor. And it's just kind of a trying time. And you might be massaging her feet during one contraction and she loves it. And the next contraction, you go to massage her feet and she yells at you to get off of her. That's pretty typical. It's okay if it happens. Just kind of move on and follow her lead, but just don't take it personal. Okay, so now we're going to start talking about some techniques for the different stages of labor. So these are going to be techniques for early labor, and I say at home because, like we talked on in the first class, we really don't want you to come to the hospital to be admitted until you're about 4, 5, 6 centimeters, really around that active labor. And so the best place for you to labor is at home by far. It's more comfortable. You aren't going to be as restricted in your movement, and you can eat, you can drink. So I definitely recommend staying at home and laboring as long as you can. And these are some tools to help you to do that. So early labor usually it's an exciting time. It's also a time of anxiety. You don't really know what's going on, or should we go to the hospital, should we not? So just kind of roll with all of those emotions. This is a time for mom to rest as much as possible. So between contractions or before those contractions really get too strong, try to rest as much as you can. A warm bath during this time is fantastic for pain relief. What you want to do is try to get the water to the nipple line, and that is going to allow water to kind of work against gravity and lift baby up out of the pelvis a little bit and relieve a lot of that pressure on mom's pelvis. So baths are great. Just make sure it's not too warm, a little bit warmer than lukewarm. Light snacks and staying hydrated is very, very important. Like I've said before, most likely once you get to the hospital, they're not going to let you eat anything. And the biggest reason for that is because things can change in labor in a heartbeat, and you might be trucking right along and everything looks great, and 5 minutes later you're running back for an emergency C-section. I don't say that to scare anyone, it's just the fact of labor. And so the last thing we want is for us to have to get back for a C-section and for you to get anesthesia and all of a sudden you've got all kinds of food coming up and we're trying to get the baby out. So typically they will restrict what you're eating. That's why I say eat before you get to the hospital. So anything light, maybe definitely sip on water, maybe some Gatorade, any kind of broth, crackers, toast, muffins, applesauce, maybe some veggies or fruits, just things that are light that feel good on your stomach. But definitely try to get some food in. Walking is fantastic for this phase of labor. There's very few things I would recommend above walking. Take a walk around the neighborhood, even just walk around the house. That really helps baby get into a good position in the pelvis and helps really speed labor up. So I highly recommend walking. Dad, you can time contractions for mom. There's actually a lot of apps that'll help you do this because there's a little bit of an art to it. And very simply, it is you start timing from the very beginning of one contraction to the very beginning of the next one. And there again, there's apps that can help you do that if you want one. Because, like we talked about in the last class, those contractions are going to start and they're going to be sporadic, maybe every 10 minutes, maybe every 20 minutes, and then they're going to start getting closer together and stronger. So when you start getting about every 3 to 5 minutes apart, that's when you want to head to the hospital. So timing them is really great. And then she doesn't have to try to time them herself. So I definitely recommend that. Dad, you can contact any people that you need to make childcare or pet arrangements, because once you get admitted to the hospital, you guys are probably going to be there for at least 2 or 3 days. So I definitely recommend making sure that everything in your household is taken care of. And here's a little word of advice from me. If you don't have one already, I would get an exercise ball. You can get some on Amazon. I think they're as low as like $10. Walmart has them. Sometimes even Dollar General has them. Just one of those exercise balls you can sit on or lean on. Those are excellent to have at home for labor and just during pregnancy. Rocking forward and backwards and side to side helps baby get into a really great position in the pelvis. It also opens up your pelvis and your hips and makes labor easier. And it relieves so much pressure. It's amazing. I highly recommend having one of those at home. You do not have to take it with you to the hospital. They will have them there. So don't worry about that. But I do recommend having one at home. And we'll go over some positions later on, some other positions like leaning on it and things like that that you can use. And before labor, definitely have all of mom's favorite movies and shows ready to watch or read to her, anything that'll kind of distract her and keep her mind off of the contractions. Okay, so these are techniques. From here on, the techniques we talk about are for active labor and transition, really when you get to the hospital and get admitted. So dad or support person, one of your biggest, you've got really two huge jobs. One is to help her stick to her goals. So if she has a birth plan or she doesn't want to get an epidural, she wants to have a natural delivery, or maybe she wants to deliver in a certain position, it's your job to help her stick to those goals. And the other job is to be supportive, offer reassurance. You are her biggest cheerleader. So these are some other things that you can help with in the hospital. You can help with position changes. A lot of times mom, especially in active labor, they'll kind of get stuck in one position and it hurts so bad. But one, their brain's not really working because they're in pain, they're hurting. And two, they're afraid that if they move, it's going to hurt worse. So helping mom with those position changes and thinking, she's been laying in the bed for a long time. Maybe we should try standing up on the side of the bed. Just some little changes like that. And I'll tell you one of my tricks, because a lot of times moms will, if you try to get them to change positions, they'll tell you no. Just tell her, listen, you've been in the same position for a while. Let's change to this position. We'll give it 3 contractions, and if it's not working, we'll try something else. Because usually you give it 2 or 3 contractions, and it really does make a difference. One of the worst things that mom can do is just lay in the bed during labor. It's horrible for pain. It's not great for getting baby to put pressure down on the cervix. So just try to keep her moving in those different positions. It doesn't have to be constant, but at least every 30 minutes to an hour, you want to try to change to a different position. Dads, you can use face-to-face interaction. There again, she's in pain, so really she's paying attention to what's in front of her face. Just don't get too close to her because she probably won't like that. Breathing with her through contractions and counting out loud is great. So if those are 2 things that work for her, sometimes that can really help. I've had moms that they want you to count 10, 9, 8, 7, and she knows by the time I get to 0, this contraction's over. Sometimes they need you to coach them, so breathe in through your nose and out through your mouth and coach them through those contractions. Preparing quotes or affirmations to read through contractions have worked very well for some moms, especially for moms that maybe their love language is words of affirmation, or maybe if you've found that your wife in the past, like when she's trying to get through a really hard workout, she says little things to herself to keep pushing her through. So quotes or affirmations might be really good for those moms. And this last one is a huge tip from me. I highly recommend it, especially for moms that want to go as long as possible without an epidural, or if they think they want to have a natural delivery without an epidural at all. I highly recommend having a safe word. So when moms get into labor and they get in pain and they're hurting, they're going to say lots of things. They're going to say things like, I can't do this anymore. I can't do this. It hurts so bad. I need an epidural. I'm done. I'm over it. They're going to say all of those things. They may not need them. I mean, really mean them. A lot of times they really don't. They're just tired and they're just hurting and they're just coping. So that's where a safe word comes in. So your safe word might be anything like banana or flower or something like that, something that wouldn't really be used in a time like labor. That way you know if she's laboring, she just got done with a contraction and she looks at you and says banana, she means go get the anesthesiologist. I'm ready for an epidural. I've thought it out. I want one now. So I definitely suggest having a safe word for that. Okay, so here's a few more labor techniques. Help her visualize the baby or other special memories. So keep focusing on what you're there for. Remember, this is pain with a purpose. It's not suffering. You are just pushing through every contraction, and each one gets you closer and closer to holding your sweet baby in your arms. You can provide her with ice chips or cold cloths for her forehead. Massage. The back, neck, feet, and shoulders are great places to massage. Counter pressure, especially with back labor. So some moms will feel labor more in their back than in their abdomen, and that's called back labor. Sometimes it just has to do with the position of the baby. So the best thing you can do with that back labor is called counter pressure, and that's what you see in this picture here. He's using the heel of his hand against her very lower back, and what you can't see in that picture is that he is probably pressing so hard. That counter pressure has to be so much harder than you would ever think comfortable. She'll tell you how hard she wants you to push, but just pressing against that pain during those contractions really helps mom, and that's where that tennis ball comes in. So especially for moms that have had a lot of back pain during their labor, they may have some back labor. So if you've got a tennis ball laying around at the house, you can take one with you because your hand will get so tired, but that tennis ball really applies good pressure. You can help her getting to and from the birthing ball, which is that exercise ball we talked about. Um, and a great thing that dads can help do is get her to and from the bathroom. So she's going to be hooked up to 2 different monitors on her belly, and she's probably going to be hooked up to an IV pole as well. So that's a lot of cords to manage by yourself. So when you get there, your nurse will probably show you how to hook and unhook everything so you can help her to and from the bathroom. Of course, you want to continue to provide that emotional support and encouragement. And remember, even with an epidural, labor is still very hard work, and she still needs your encouragement and support. So you do not want to be this support person. You can you can see his shirt says, "I did this to you," and she's looking at him like, "Yeah, you did." So you don't want to be that person. You do, however, want to be this one. So he says, "Hey girl, I love how you bounce on your birthing ball." So you want to be like Ryan, okay? Give her that encouragement. It's just a little funny. It makes me laugh every time. Okay, so these are some affirmation examples. You can find tons of these on Pinterest or if you Google them, and they actually make books for them as well. So if this is something that has really helped you through pregnancy, or if you're one of those people like I am that like if I go for a run, like I've constantly got things in my head like no pain, no gain, things that really are going to push me through. Birth affirmations really might be for you. So I'm not going to read all those to you, but those are some good options to just kind of coach mom with. Labor massage. This is great for releasing endorphins and for pain relief. It also helps mom to relax. So if you think about how you feel when you're in pain, let's just say you were doing yard work and you lifted a heavier tree trunk than you should have and you tweaked your back and your back's really hurting and now you're driving to work and your back hurts in the car. Think about how tightly you're probably gripping the steering wheel, right? You're probably pretty tense. It's the same way during labor. A lot of times moms will scrunch up their faces, their hands will be clenched and tight. Sometimes they'll even curl their toes. It really is a time for just a lot of tension that goes along with that pain. So massage can really help loosen all of that up. So just remember, mom might require a much firmer touch during labor than usual. And you really do want to practice things like this before labor to see what she likes. There's some people that hate it when you touch their feet. Labor is not the time to try to touch their feet. Okay, so just talk about it beforehand and see what she likes. Forehead, back, neck, shoulders, hands, and feet are all great places to use massage. There again, those hands, like people never think about that, but you carry so much tension in your hands. Visualization can be very helpful for some people. Finding a focal point on the wall. It might even be something as small as a scratch on the wall, and that's what mom focuses on during every contraction. Or it might be something in the room. It might be just looking at dad's face. I mean, that may comfort you and motivate you to get through every contraction, especially if he's looking at you in your eye and coaching you through that contraction or breathing with you. A photo that you bring with you might help you. You can visualize something soothing or a happy memory. Like if your happy place is like mine, you like to be on a beach, you can think about being on a beach. And ultrasound pictures really do help too, because it's easy to forget during labor exactly why you're there and what you're working for with every contraction. So having those ultrasound pictures to focus on really do help. Just thinking about, okay, I'm 8 centimeters, a couple more centimeters, and I can hold my baby. breathing support is a huge piece of labor. Huge. There's a couple of different variations of breathing we'll talk about, and I'll tell you what you're going to hear most commonly from your nurse. So there is a cleansing breathing method where right before a contraction starts to come on, you take a really big, deep cleansing breath and then you let it go. That can work really well. Slow breathing. This is the one you're going to hear from your nurse most likely, and she's probably going to sound like a broken record, but this is where we tell you to breathe in through your nose, breathe out through your mouth. And we will tell you that over and over and over because really that breathing is going to do so much. It's going to relax your face, relax your shoulders, and breathe down into your body. It's really going to ground you. Take that focus away from your contractions. A lot of times it just takes 2 or 3 of those big deep breaths and you're through another contraction. It does so many different things. Holding your breath is never the answer. Unless you're pushing, then your nurse will coach you. But you never want to hold your breath during labor. Remember, if you're holding your breath, your baby's holding his or her breath too. So that is not the answer. And the variable breathing, that's one that I know you've heard about before, the he-he-hoo breathing. I have never had a patient do that. If you can practice that and that works for you, it has worked in the past. I haven't seen it done really, but that is another technique. So there again, remember not to hold your breath and relax all of the muscles in your face. Okay, so now we're going to talk about positioning for labor. There are lots of different labor positions, and you just kind of have to find what works for you. But the biggest thing is remembering not to lay in the bed and not to stay in one position or another. Now, I will say, once you get an epidural, you have to stay in the bed because your legs don't work. So then your nurse or your husband or dad will probably be turning you from side to side. So you'll want to lay just side to side, really. You don't want to stay completely on your back. But otherwise, especially during those first few centimeters, you really want to be changing position. So these two are great. Standing position, you can see she's leaning on dad. That's a great supportive position. Sitting positions are great. That exercise ball, I promise you it's magic. Those are fantastic. That one down on the right hand corner, you can see mom is leaning into dad. That is very comforting. I love that position. It also allows dad to be able to massage her shoulders or whisper into her ear through each contraction. You're kind of working through every contraction more together. So I do love that position. And then a little known fact is the toilet is actually one of the best places to labor. I don't recommend it for delivery. It's not really where you want your baby to land first thing out of your womb, but it happens. But during labor, it is great because it's kind of like that exercise ball. It's just going to relieve so much pressure in your pelvis. So if that's an option for you at the hospital, or even just keeping this in mind at home, you can put a pillow at the back of the toilet and you can either lean against it or you can actually turn around backwards on the toilet and lean over that pillow. And that's a great place to labor. So these are a few more. I'm gonna go ahead and say I have no idea what that couple in the left-hand corner is doing, but if it works for you, go for it. These other ones are great. They're again walking, as much walking as you can do during labor. That's where it's at. Walk as much as you can. Even if you are attached to the monitors and you can't walk in the hallway, you can still kind of pace back and forth by the bed. Moving from side to side or dancing, you can see in both of those other stances, mom's leaning into dad. So make sure your partner can support you before you do this, most definitely. And if not, the bed is actually a great place to do that as well. The bed in the labor room does all kinds of crazy things, but you can raise it up and down so mom can actually lean on the bed and then kind of sway from side to side that way as well. So these are some creative positions that really work very, very well. Some of these you can do at home. The picture up on the top corner, you just take that exercise ball and you put it in the bed and you can lean over it. You can do that at home. And then the picture under that, she's doing the same thing just without the ball. She's probably going to get pretty tired soon though, just trying to support her own weight. So the ball really, really does help. That one at the bottom is a great position. You can even deliver in this position. That's just leaning over the bed and letting the bed kind of take all of her weight. And then that woman down on the right hand corner, I don't super recommend that during labor unless maybe you do a lot of yoga or Pilates. Maybe that would help you. I would just fall over if I tried to do that, but it is another option. And then that picture in the top right hand corner, that is a different kind of exercise ball, and it's called a peanut ball because it obviously looks like a gigantic peanut. And that thing is pure magic. It's amazing. They will have these on labor and delivery as well. And a lot of times we'll pull these out when you get further along in your labor. They just do wonderful things. They open up your hips in great, great ways. So those are some positions you can do at the peanut ball. If the nurse pulls that out, she'll get you in a good position to use that. But that thing is awesome. And there's just a couple more. There again, this lunge thing, I don't know what's going on. I really don't recommend that. I would be on the floor. But if you got some strong legs and you want to try that, go for it. And side lying is another position, especially if you get an epidural, that you can use just laying on your side and kind of trying that out. That can relieve a lot of pressure. So let's touch on back pain and labor just a little bit more. If you are laboring in your back, just the biggest thing is don't lay on your back. Get out of that bed or at least get off your back. Hands and knees is a fantastic position to relieve back pain. That allows baby to just hang and lets gravity kind of take the weight of baby off of you. That's a great position. It's also a great position to deliver in if you don't have an epidural. Side lying, birthing ball, leaning on the back of the bed. We've already talked about those positions. If you are allowed to get in the shower, that's a great place to just let that hot water run over your back, and that can alleviate a lot of that pain and pressure. Heat packs, the hospital will definitely have heat packs you can use. Those are great. And there again, massage, counter pressure, and tennis balls all really help with the back labor. Okay, we're almost done, I promise. I know this is so much information. These are just positions for pushing. So your doctors and nurses will help you get into the best position for you. If you have an epidural, you're really limited because your legs just don't work. You can't support yourself. So most likely you will be delivering in the dorsolapotomy, which is that picture in the middle. That's the great position that we all love when you go see your OBGYN. But that one is one of the best and one of the most common positions. You can also deliver on your side with an epidural. Sometimes you can do hands and knees if you really need to, but you need a lot of help to get into that position with an epidural. And there again, sometimes you just can't. But these other pictures are some of the other positions you can deliver in. The one in the top right hand corner, it's not really a delivery position, it's more for labor, but this is called tug of war. So you can see that the nurse is holding one end of a sheet and mom's holding the other. Especially when moms start to get tired when you're pushing, or if you're not pushing very well, or if your epidural is really dense and you can't really feel the muscles you need to use to push, tug of war is where it's at. It's a workout, but it really, really works well. So when you're pulling back on that sheet, with all of your might against the nurse, you actually, without even thinking about it, are bearing down and using the right muscles you need to push. So sometimes they'll pull out the sheet and tell you you're going to play some tug of war for a while. So it's really fun. Anyway, and then under that is that birthing stool. If you're going for a natural delivery, most hospitals have birthing stools. Takes a little bit of help to get down onto it, but it's a great position for delivery. And then that bottom right hand picture is a mom using the squat bar. So that's just using that squat bar to support all of her weight, and she's in a squatting position. Again, great for delivery. And then side lying in the middle, and then on the left hand side, that mom's kind of in hands and knees position, and that's actually one of the best positions you can deliver in. It's most natural, prevents a lot of tearing. It just seems to be a lot better for mom. So if you can, and that's something you want to try, go for it. So those are some positions for pushing. There again, you don't have to worry about that. Your doctors and nurses will help you with that stage. Okay, so these are some resources that I recommend if you want some additional education about stuff like this or some other tools to take with you. This first one is a good resource for labor for moms and dads with some good tools. That second one, it says it's for normal labor education. That's really for if you want to go natural, then that's a good resource for you. The third one is aromatherapy. So if you are an essential oils kind of girl, that's a great resource for you. It actually gives several recipes to you, so you can use that one. And then the third one is birth handouts. Those have just some great free handouts you can download to take with you. So these are just a few of the things that we've gone over. This really goes back to what we talked about in that first class. So these are when you want to go to labor and delivery, just kind of a little refresher. When you are having contractions, about every 2 to 3 minutes apart for 3 hours, and more like the 5 to 7 range if this isn't for your first baby. If you are having preterm contractions, more than 4 in an hour. If you are having any bright red vaginal bleeding, a temperature greater than 100.4, if you can't get your kit counts or you feel like baby is not moving as much, any pain or burning with urination, if your water breaks or you think your water broke, definitely go to labor and delivery. We didn't talk about this a lot yesterday, but once your water breaks, that's actually breaking the barrier between baby and your vagina. So that if you go on and you ignore it, you could eventually get an infection. So once your water breaks, you're kind of on the clock, like you need to have baby within the next day or so. So when your water breaks, definitely go into labor and delivery. Even if you're like, I don't know, I might have peed myself, because that happens during pregnancy. Even if you don't know, it's better to be safe than sorry and go into triage. If you're vomiting or you have diarrhea greater than 24 hours, or if you feel like there's anything that's just not right or you have any concerns, please don't hesitate to go into labor and delivery. At the very minimum, call them, but it's always better to be safe than sorry. Okay, so this says birth is not only about making babies, birth is about making mothers, strong, competent, capable mothers who trust themselves and know their inner strength. So, mamas, listen, I know there's a lot of fear, I know there's a lot of anxiety, and I know that during a time like this, when people are being quarantined and there's a virus going around, I know that that fear wants to take over. But when it comes to labor and delivering your baby, your body was made to do this. You know how to do this. There is nothing that's going to stop you. And I promise you, every single contraction will bring you closer and closer to holding your sweet baby boy or girl. And it is so true. Once that baby is on your chest, the rest of the world just kind of fades into the background. It really, truly is. It's magical. It's beautiful. And it's an incredible experience. So just try to lean into that and find comfort in your own strength. Um, and just take it as it comes. You got this. So that is the end of this class. I know that was so much information. I hope that you got a good grip on some things that you can do and some tools that you can put in your tool belt to take with you to labor and delivery. And again, if you have any questions or concerns, you can just comment them down below or reach out to us at Lifeline, and I will be more than happy to get back to you on all of those things. So, good luck. You're going to do amazing. God is with you, and we're here for you at Lifeline if you need anything at all. And we will see you soon.